Stomach 1 is located inferior to a pupil looking directly forwards in a depression between the eyeball and the infraorbital ridge. So to locate this point, you need to actually stand in front of the person, have them look towards you, and mark your point in a depression between the bone and the eyeball itself. Stomach 2 is located 1 cun inferior to a pupil looking directly forwards. To find this point, you'll need to stand directly in front of the person, palpate inferior to the pupil by about 1 cun, and you should feel a dip, which is the infraorbital foramen. Don't press too hard though, because there's a nerve here and it can be quite tender. Stomach 3 is located inferior to a pupil looking directly forwards, level with the lower border of the ala nasi. To find this point, you need to stand directly in front of the person, have them look forwards, think of a line running through their pupil and coming down, and marking this point on a level with the inferior border of the ala nasi. This point is frequently just lateral to the nasolabial groove. Stomach 4 is located 4 fen lateral to the corner of the mouth. It's in the nasolabial groove. Have the person smile and you can see this point falls nicely into that groove. Stomach 5 is located directly anterior to the angle of the mandible. So the first thing you need to do is to locate the angle of the mandible correctly. Palpate along its posterior border, inferior border, until you find where the jaw is changing direction. Then come forwards over the masseter muscle. If a person clenches their masseter muscle, you'll be able to find a nice groove just as its anterior border. And this is your stomach 5. To locate stomach 6, palpate the posterior and inferior border of the mandible to find the angle of the mandible where the jaw is changing direction. Come 1 finger breadth superior and anterior to the angle of the mandible. When the person clenches their jaw, the masseter muscle comes up. When they relax, your finger will fall into the nice dip that is stomach 6. Stomach 7 is located directly superior to stomach 6. Palpate upwards until you come to the zygomatic arch, and then come back down until you fall into a dip that is just anterior to the condyloid process of the mandible. Stomach 8 is located directly superior to stomach 6 and stomach 7. So run your finger up in a line from stomach 6 and stomach 7, projecting up onto the corner of the head until you're in a nice depression just superior to the temporalis muscle. Stomach 9 is located on the side of the neck on a contour with a laryngeal prominence. It's in between the sternocleidomastoid and the thyroid cartilage. The important thing here is to palpate medially across the sternocleidomastoid and feel for the carotid artery. This point must be located medial to the carotid artery so that you mark it in between the carotid artery and the thyroid cartilage. Stomach 10 is located midway between stomach 9 and stomach 11. It's on the anterior border of the sternocleidomastoid, so be sure to palpate down the muscle to find this point. Stomach 11 is located just superior to the medial end of the clavicle. It's in between the sternal and the clavicular heads of the sternocleidomastoid. To bring these into relief, ask the person to turn their head sideways. We can find the sternal and the clavicular heads of the sternocleidomastoid, and here's the depression for stomach 11. But be aware of the fact that when the person turns their head back to the front, the dip will move laterally slightly.
Stomach 12 is posterior to the midpoint of the superior border of the clavicle. Frequently there's a nice little notch there. Stomach 13 is on the inferior border of the clavicle, fourth and lateral from the midline. Stomach 14 is in the first intercostal space, fourth and lateral from the midline. Stomach 15 is in the second intercostal space, fourth and lateral from the midline. Stomach 16 is in the third intercostal space, fourth and lateral from the midline. Stomach 17 is in the centre of the nipple. This point is never moxed or needled. Stomach 18 is in the fifth intercostal space, fourth and lateral from the midline, at the root of the breast. Stomach 19 is tooth and lateral to the midline at the level of Ren 14, which is 6 sun superior to the centre of the umbilicus. Stomach 20 is 2 sun lateral to the midline, 5 sun superior to the centre of the umbilicus at the level of Ren 13. Stomach 21 is 2 sun lateral to the midline at the level of Ren 12, which is 4 sun superior to the centre of the umbilicus. Stomach 22 is 2 sun lateral to the midline at the level of Ren 11, which is 3 sun superior to the centre of the umbilicus. Stomach 23 is 2 sun lateral to the midline and 2 sun superior to the centre of the umbilicus at the level of Ren 10. Stomach 24 is 2 sun lateral to the midline at the level of Ren 9, which is 1 sun superior to the centre of the umbilicus. Stomach 25 is 2 sun lateral to the midline at the centre of the umbilicus. Stomach 26 is on the lower abdomen, level with Ren 7, which is 4 sun superior to the pubic bone, 2 sun lateral to the midline. Stomach 27 is on the lower abdomen, 3 sun superior to the pubic bone, level with Ren 5. Stomach 28 is on the lower abdomen, 2 sun lateral to the midline, at the level of Ren 4, which is 2 cm superior to the pubic bone. Stomach 29 is on the lower abdomen, 1 cm superior to the pubic bone, 2 cm lateral to the midline. Stomach 30 is on the lower abdomen, level with the superior border of the symphysis pubis, level with Ren 2.
Stomach 31 is often described as being at the junction of a vertical line drawn through the anterior superior iliac spine and a horizontal line drawn through the greater trochanter. More importantly, it lays on the lateral aspect of the muscle sartorius. To bring this muscle into relief, have the person cross their legs. It should now be possible to palpate over sartorius and find a nice depression lateral to it. When the person brings their leg back to a resting position, you will find that this point may not lie exactly on where those two lines join. Stomach 32 is located 6 cm superior to the superior border of the patella on a line joining the lateral border of the patella to the anterior superior iliac spine. If you divide the distance between the superior aspect of the patella and the prominence of the greater trochanter into 3 equal parts, this point will lie just a little more proximal than the lower third. Stomach 33 is 3 cm superior to the superior border of the patella on a line joining the lateral aspect of the patella to the anterior superior iliac spine. It's half the distance between the superior border of the patella and stomach 32. This is stomach 33. Stomach 34 is located 2 cm superior to the superior border of the patella on a line joining the lateral aspect of the patella to the anterior superior iliac spine. As the patella itself is 2 cm long, we can use this measurement to help find this point. Another useful tip is to have the person press their leg down into the bed. This point will be found in a nice cleft at the inferior border of vastus lateralis. Stomach 35 is located on the lateral aspect of the knee when the leg is flexed. It's on a level with the inferior border of the patella and lateral to the patellar ligament. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Stomach 37 is located 10 cm superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the breadth of your patient's finger, not your own. Stomach 38 is located 8 cm superior to the prominence of the lateral malleolus and 1 finger breadth lateral to the anterior crest of the tibia. This makes it halfway between stomach 40 and the anterior crest of the tibia. Stomach 39 is located 7 cm superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the width of the body's finger, not your own. This point therefore lies inferior and anterior to stomach 40. Stomach 40 is located 8 cm superior to the prominence of the lateral malleolus, 2 finger breadths lateral to the anterior crest of the tibia. To locate the anterior crest of the tibia, place your 2 fingers along the anterior part of the leg and feel for the bony ridge. Remember, when you measure 2 finger breadths lateral, they're not your own finger breadths, they're the size of your model's finger. These fingers are smaller than mine, so when I mark this point, I will make sure that the marks are closer to the anterior crest of the tibia than the width of my 2 fingers. Stomach 41 is located on the anterior aspect of the ankle flexure. It's on a level with the prominence of the lateral malleolus. It is located in between the tendons of extensor hallucis longus and extensor digitorum longus. To reveal extensor hallucis longus, get the person to pull their toe up against resistance. Locate this point in a nice dip just lateral to that, actually in the ankle joint. Articulate the ankle to make sure you are actually in that joint. Stomach 42 is located on the dorsum of the foot between the 2nd and 3rd metatarsals and the cuneiform bones. It's approximately 1.5 cm proximal to stomach 43. In some people, when they point their foot and pull up their toes, a nice depression appears here. Stomach 43 is located on the dorsum of the foot between the 2nd and 3rd metatarsals. It's 1 cm proximal to stomach 44. An easy way to find it is to divide the distance from stomach 41 to the end of the web margin between the 2nd and 3rd toes into thirds. This will give you your location for stomach 43. Stomach 44 is located 0.5 cm proximal to the web margin between the 2nd and 3rd toes. This point should fit nicely into the flare of the base of the proximal phalange of the 2nd toe. Stomach 45 is the lateral nail point of the second toe. Be sure to mark this point clear of the nail bed and in the flare of the base of the distal phalange.